Welcome. This is Birth, baby. Your hosts are Sierra Morgan and Samantha Kelly. Sierra is a birth doula, hypnobirthing educator, and pediatric sleep consultant.
Samantha is a birth doula, childbirth educator, and lactation counselor. Join us as we guide you through your options for your pregnancy, birth, and postpartum journey.
Today we have Cheryl Reilly with us. She's a licensed clinical social worker specializing in perinatal mental health, and she's here to help us understand what PMADs are and how to know if you have one.
Thank you so much for being with us today, Cheryl.
Yes, I'm so happy to be here. Thank you for inviting me.
Absolutely.
Can you tell us a little bit more about you and kind of how you got into this work?
Sure. So my name's Cheryl Reilly. I'm a licensed clinical social worker. And I have a private practice here in Austin, and I specialize in maternal mental health care. I have been a therapist. Well, I've been licensed as a clinical social worker since 2011, but I started out in medical social work. And so I worked in the hospitals and did a lot of case management and crisis management. But the end goal was always to go into therapy. And so when I decided that was the next step in life, I really had to sit down and think like, okay, who are we going to work with? Who do I work best with? And, what do I want to talk about all day? And that is how I got into maternal mental health. And it's been great ever since.
So is that before or after you had kids? That was after, yeah? No, I don't know how old your kids are.
Yeah, no, my kids they range. They're 14, 11, and 4. So yes, I worked in the hospitals before I had kids, or while I was having kids, I guess. But the maternal mental health came kind of during my pregnancy and fertility journey. I had a couple miscarriages, and yeah, it was a strange road. And I felt like, man, I really wish I had been supported better or had more support available to me. And so again, when I was going through the process of figuring out who my population was going to be, and what I wanted to talk about all day, it had to be maternal mental health, because it was something that was so personal that I went through. And I was just like, I need to make sure that this is out there for others.
Isn't it so neat how so many of us come to our calling by a personal experience in our lives? Like, so many of the people we interview for this podcast are saying the exact same thing. Both Samantha and I came into birth work because of the same reasons in our own lives. So it's really neat to see how that evolves for people.
Oh, yeah. And especially for helping professions. Like, you don't get called to a helping profession unless you have a personal experience that somehow, brings you there.
Definitely. Yeah. So tell us a little bit about how, I guess just a little bit more about how you became a therapist, what that process looked like of schooling and all of that.
Sure. So I originally went into undergrad thinking I was going to be a chiropractor, and quickly realized that was not a good fit for me. And so I was like, we need to pivot. And my minor at that point was psychology. So I just switched over to psychology, and that was such a better fit for the way that I learn and the things that I, grabbed my attention. So I graduated my undergrad with a degree in psychology, and also very quickly realized that I was going to need a master's degree to do anything that really felt in the way that I wanted to go in my career. I was going to need a master's degree. So I applied to this dual degree program at the University of Illinois, and it's a degree that has a master's degree in social work and a master's degree in human and community development, which basically means I just learned how to research really well and read research, really well, and also the practical parts of social work. But in the social work part, they had different specializations. And at that time, I was really afraid of mental health. And I was like, nope, not going to go down that path. So I chose healthcare because, again, I started out wanting to be a chiropractor. So that made sense in my life that I was like, oh, I can put this healthcare piece and the social work piece together and work in healthcare. And that was great because the hospital system gave me so much experience with all different populations, all different ages, all different diagnoses. Like I got so much experience um, with people at the hospital system. So I felt much more confident at that point that I could go into mental health after that. But for me, like grad school straight to mental health was very scary. So I needed a little buffer zone to go through.
I I really love that you have all of that experience, and that's why I love referring people to you, because it's like even if you couldn't help them or maybe didn't feel like you were the perfect fit for them, I always know you know how to tap into that, and that community relations or whatever you said portion of that
Yeah.
is probably helpful. For those that don't know, because a lot of the people listening may not be in our hypnobirthing classes, I have you in to talk in my hypnobirthing classes on class 5, which is our last class. And I always love for you to explain things to people, because so often we have people not really understand who might need perinatal therapy, or like how do you even know if you need it? And a lot of people just think that everything is the baby blues. Like, oh, it's not a big deal because everyone has this afterward. And I know you and I talk a lot about common versus normal. And
Mhm.
so it's very common, but not normal. So can you talk to us a little bit about how to know the difference if someone was having baby blues or if it's a PMAD, and what in the heck is a PMAD?
Yes, for sure. So a PMAD is a unfortunate acronym for perinatal mood and anxiety disorders. And it's so PMADs are anything in the perinatal period, which is pregnancy through the first year postpartum. And then you have our mood disorders, which include depression, our anxiety disorders, which are like generalized, obsessive compulsive, panic. And then it also includes postpartum psychosis. And then a disorder on a general explanation level is anything that negatively impacts your day-to-day life. So that's kind of the baseline for, is this just something that we're experiencing that's temporary and, it's uncomfortable but not diagnosable, versus the disorder where it's like, this is affecting my day-to-day life. So yes, we talk a lot about the difference between baby blues and PMADs, especially postpartum depression. And okay, so baby blues, typically the two differences are timing and intensity. So the baby blues typically start around day 3, 4 postpartum and typically resolve around day 14 postpartum. And intensity wise, we're looking at mild symptoms. So mild teariness, mild feelings of sadness, maybe a little bit of lack of motivation. But again, taking into context that we have a 2-week-old newborn and we're probably also not getting a lot of sleep. So that's our baby blues. PMADs are, especially postpartum depression, typically come in after those first 2 weeks. They usually peak around month 4. But again, anytime between pregnancy and the first year postpartum, we'll consider a PMAD. And then the intensity is much higher. So we're looking at like really struggling to get things done day to day, like just don't want to take a shower, not feeling motivated to feed the baby. Yeah, just all of those things are taking so much more energy to get done. And then of course we have, not of course, but also we have like intrusive thoughts become problematic where they're like really distressing, or thoughts of, I'm doing such a bad job and my family would be better without me. So anytime those kinds of things come into play, then we want to talk more about, is this a PMAD and what should we do next?
Are there ever times where you see people that didn't really have a whole lot of signs of baby blues or PMADs in the early stages of that perinatal period, and then, 6 months or 9 months in, all of a sudden it happens? And I'll caveat here that the reason I'm asking is because I definitely had postpartum anxiety and didn't know it. But
Yeah.
I think that the older my son got, the more intense my intrusive thoughts became. on th bad things happening to him. It was at first it was like sleep related. I just had such anxiety around sleep and
Yeah.
how much sleep am I going to get? But
Yeah.
then it became like I'm walking upstairs near the
Mhm.
edge of the rail and like what if I fell right now and he went over or like crazy weird not to use
Mhm.
the word crazy, but to me
Yeah.
it was just like what in the world is going on with my brain? Is that common that it would kind of intensify over time?
Right. Yes. Common, normal. Yes. The symptoms of PMADs are really all over the board, and they're so individualized to each person, especially timing wise, because so much is happening in your body and so much is happening around you. Like, are you going back to work? Are you not going back to work? Is baby sleeping through the night? Is he not sleeping through the night? Feeding, like, there's so many other things to put into context. And so sometimes these symptoms really ramp up at the beginning because we know that mom's going back to work at 6 weeks. And so all those feelings kind of get jumbled up at the beginning versus, yeah, maybe baby's getting older. And so now you're like, oh, well, there's these new transitions and that's really scary, right? So it's the other thing I will say about when symptoms seem to get more intense a little farther along in that postpartum period is that sometimes your like ability to handle it is just depleted. And like you have pushed through and powered through and I've made it this far and we're doing so great and like you're just tired, and your brain is like, we need more help than what you're giving us and you can't push any more. And so sometimes those symptoms peak later because you just don't have any more energy to give to it to keep them under control, if
That
that
makes
makes.
sense, the cumulative effect.
Yeah, for sure. Like you've tried so hard and then like at some point you're going to reach that breaking point.
So, what types of PMADs are there, and what are the signs to look out for those different diagnoses?
Sure. So our mood disorders are going to include depression, um and the anxiety, like I said, is general anxiety, panic disorder, obsessive compulsive, post-traumatic stress disorder. And then also not in the acronym is postpartum psychosis. So the symptoms that we're looking for are in depression are lower mood, lower motivation, not eating as much as usual, sleeping too much, sleeping too little, things that are out of the ordinary and generally just a lower mood, less motivation. And it's not that moms and other people who are experiencing PMADs are not getting things done. It's taking a lot of energy to do them. Like we know that we need to feed the baby, and it is taking so much energy to get that done. So those so sometimes I think we have this picture in our head of depression where it's just like laying in bed and crying and not going to work, not getting our things done. But it might not actually look like that. It might look like we're getting our things done, but it is draining and depleting. And the thoughts that are running through our head are just very negative and, yeah, just very negative thoughts.
I love that you
Whereas,
say that real quick because
yeah.
actually one of the people that I sent to you for this, I thought was a great mom. And then she called me and she was bawling, feeling like she wasn't good enough and really like critical of how her partner was doing things and felt like he was really critical of her. And he was like, I feel like I'm being supportive. And, from the outside, I thought everything was fine. And I was so surprised when she called me crying. Actually, her husband messaged me and said, can you please check on her? I think something's wrong.
Mhm.
And then I was like, Cheryl,
Yeah.
here's her information immediately. But yeah, from the outside, it might look like everything's going fine. So I love that you say that because internally she was not okay.
Right. And part of that, is cultural and societal, is that we put so much pressure on moms to have this perfect birth experience and perfect postpartum experience. And, the minute the baby comes out, you just love them so much and, you're connected. And that is just not always the case. Like, this is a new human who you've never met, they've never met you, and we have this expectation that we just are connected and bonded and everything's perfect. And I actually was just talking to a client yesterday, and she was like, I wish someone would have told me that it was okay to not be, completely in love the first day, week that the baby came out. Like, it might take time for us to learn how to love each other and to have that bond. And, he's, I want to say, like 4-ish months now, and it's very different, her experience, but she felt so much pressure and felt so like something is wrong with her because she doesn't have this immediate bond to the baby. And by no means did she have postpartum depression. She just had met her new human, and she had never been a mom before. And so it's a lot of transitions that we don't give grace to, and we just expect everything's supposed to be perfect and wonderful.
Yeah, definitely. I feel like it can be hard to, as a parent, but also as a partner, I would imagine, it would be hard to kind of figure out what is the norm. Like, is this all going beyond the range of normal, and who do I go to for help? And I feel like that's why it's so important for everybody involved in the care, the providers and the doulas and partners and everybody to be asking the questions and kind of
Mhm.
going through the things and identifying, oh, I think this person is struggling a little bit more than what would be the typical. And yeah, just kind of going through all of that together as a team, because one person may see it and another person may not. And that one person that saw it could be, the difference in identifying one of those.
For sure. And that's the thing, like, during pregnancy and postpartum, we should be asking, are you experiencing any of these things? Like, you should be getting a screening tool done at least once during pregnancy and at least once during your postpartum period. But what I'll say about that is the one screening that is typically given is the Edinburgh Postnatal Depression Scale, which is great scale for postpartum depression, but it's not super great at catching anxiety, which is a lot of what I see. Is those intrusive thoughts, the counting the hours until, like, how much sleep am I going to get, and so yes, we are pretty good about screening for postpartum depression, but we're not super great about screening and identifying anxiety until somebody mentions it or we've reached that breaking point. Like, I feel like I'm going crazy, and like, am I crazy? Because I feel like I'm going crazy. And then by the time they get to me and I'm like, okay, well, it's anxiety, and like, let's talk about that. They've been experiencing it for a long time.
We had a
Yeah.
funny moment in the last hypnobirthing series where when Cheryl was in class, one of the people said, well, if no one's asking me these questions at my appointments, how do I know if I'm having this? Because she's like, I've never been asked and so far in my pregnancy. And Cheryl was like, well, there's a website you can go to and it has the depression scale and then it also has the one for anxiety. And she goes, okay, so I can do them myself. And you were like, yeah. And then she goes, so like how often should I take them? And I
Yep.
said, well, I said, I wish it had an IP address log where it's like it would
Yep.
only let you look a certain number of times in a month or something. But I said, well, I think that if you are wanting to do it, once a week, maybe that's a sign you might have anxiety. You're having
Yes.
anxiety
Might be
about
a
having
symptom.
anxiety. Yeah.
Yes. Yeah,
But you can take them
exactly.
on your own, and we can link those in the show notes, those two websites, just so if you don't feel like somebody is looking
Mhm.
out for you, you can do it.
Absolutely, right? Like, they're so self-explanatory. It'll like, websites are so good, they'll just like pop out the number at the your score at the end, and usually it'll have like a indication of what the score means. But for the EPDS, the Edinburgh Postnatal Depression Score, the PHQ-9 and the GAD-7, which is general anxiety disorder, it's a 7 question. For all three of those, really anything over a 10, we're like, oh, okay, let's talk about this, right? So it's not anything that takes rocket science to go through and do and decide if this is something that you should be getting checked out. Now, that being said, if you go through one of these and you get like a 6, but you don't feel good and you still feel like this is impacting you in some way, then okay, great. Like reach out to your OB or your doctor, or if you have a therapist, and say, hey, I did the GAD-7 online and I got a 6, but I still don't feel good. Can we talk about this? Right? Like it's just a screening tool. It's not a diagnosing tool.
Yeah, definitely. So what are some of the risk factors of PMADs? And like, is there anything that anybody can do to kind of reduce their risk?
Oh gosh, I wish there was. It's not that
Cheryl,
yeah.
do you remember? Is there a vitamin I can take? Are there foods I can eat? People ask the best questions in my classes. So
They
you have to answer. Is
do.
there a vitamin we can take? Is there a food we can eat?
I mean, there's just not. I'm sorry. I
You've
wish
not
there
come up with a
was.
magic answer yet?
If there was a magic pill,
Oh,
I would give it to you. I promise.
but then you wouldn't have a job.
I know. And then I'd be like, oh, now what am I going to do with these skills? Thanks, guys. Yeah, people in these classes, every time somebody asks, like, is there something I can eat or is there something I could take that will prevent me from having this? And honestly, I do wish there was. And my answer every time is you're going to eat the things that you're going to eat safely during pregnancy. That all stays the same. There's not a supplement that is going to prevent it. Are there things that we can do to mitigate the risk? Yes. But again, that's still not 100% saying like, if you do this, you will not get postpartum depression. So our risk factors that we're looking at are any trauma in your personal history puts you at a higher risk because birth and postpartum are inherently out of your control in some ways and can feel very risky and scary. And there are times where it is traumatic. So any previous trauma puts us at risk. Socioeconomic instability, again, raises that stress level. And so the transition into parenthood is harder. Any history of anxiety or depression beforehand, or any family history, especially in mom or sisters with postpartum mood disorders, mood and anxiety disorders, puts you at a higher risk. And then also remembering that it's not just the pregnant person that can get a PMAD. We also see it in dads. 1 in 10 dads has a PMAD, which is probably higher, and we just don't identify them or diagnose them. And then also grandparents or adoptive parents can also experience these things because it's not just about the hormones and what's happening in the pregnant person's body. It's so much more that we're taking into context.
And same-sex non-birthing
Yes,
parents, right? So if it's two
absolutely.
moms, if it's two
Yep.
dads that adopted a baby, adoption still, both parents could experience that. A same-sex or a heterosexual adoption, all of it,
Absolutely.
everyone could get it. A foster parent could get
Yeah,
it.
for sure. Yeah, absolutely. Because there's so many things that are happening during this transition that really throw off, your mental health and your own self-care that you're probably
Yeah.
neglecting a little bit during this time.
I always think it's so important for partners to know that this is possible because, and I make seriously, I think that's one thing that I, without fail, have told every single partner because I always tell them if I were to come to you after you have this baby and I say, I really think that you might be experiencing a PMAD, I really think you should reach out to XYZ or whatever, or here are some resources. If you never even knew that was a possibility, be like, what are you talking? That's
Mhm.
ridiculous, right? And you're also already in a heightened state of anxiety or whatever. So you're even less likely to be receptive of what I'm saying. However, if I already told you and I already warned you that you would have this reaction, then
Mhm.
you might go, oh, shoot, Sierra thinks, wow, I'm not one. Like they said, 1 in 10, that's me, I guess, and they would be a little bit more softened to receiving that information. So I'm so glad you said that.
Yeah, and we're not screening partners, we're not screening grandparents. They're not going into postpartum appointments. They're not going in, well, they might be going into the pediatric appointments, which sometimes the pediatrician will screen mom, but it's highly unlikely that they're also screening the partner. So yeah, the doula might be the only person, or, you know, a lactation consultant, somebody who's in their business in the best way possible, right? Like, might be the person to identify it because no one else is looking for it.
Yeah, it's so hard. I think as, you know, as a doula, I often will walk into postpartum appointments and, you know, mom is in that newborn baby bliss stage and she's just living it up and you just see dad hurting, you know,
Hmm.
going through all of it because it is such a big transition and those moments of transition can be so hard for them. So how can partners help when someone is experiencing a PMAD?
Yeah, that is a hard one. Because again, like, I wish we could just like take it away for that person, you know, but being supportive and validating that this is something we will work through is going to be super helpful. And I guess the opposite of validating would be invalidating the partner. And that, I think, is where a lot of, you know, typically moms are feeling like, this, like, I feel like I'm going crazy, you know, and if I say that out loud, people, or, you know, the partner are like, this is just how it is to have a newborn. Like, it's really hard. This is just how it is. And mom's like, no, no, like, this is not normal. What I'm experiencing, and, you know, trying to explain, like, I think something is wrong. Having that partner hear them and support them and say, okay, I hear what you're saying. Let's move forward in, you know, calling the doctor, calling the therapist, um, maybe bringing up the idea of some medication. Maybe we need some anti-anxiety, maybe we need some antidepressants to get through this stage. But the more supportive that partner is, the more receptive maybe the person who's experiencing some of these symptoms would be to getting the help that they need.
Yeah.
Whereas if that partner is like, nah, you're fine, this is just how it is, like, that's not going to be as helpful.
And texting the doula, just like that client
Yes.
that did for me. I mean, honestly, that was just his first Hail Mary attempt of like, I don't even know what to do, but here, maybe Sierra can help.
Hmm.
And I'm immediately texting Samantha and letting her know that one of our clients is struggling. And I think that another thing that's so important is, you know, yes, what can help, but what can harm? And you were saying the invalidation, also making them think that they're not a good parent because of it. Like I've had some people say, well, do you think she should even be around the child right now? Like she's crying all the time. Don't you think that that's bad for the baby? And then the mom feels even worse about, oh my gosh, see, now I'm hurting my child by crying around him and I'm impacting him. And I had to say, look, this, you know, I am not a doctor, I am not a therapist, but I would bet my life that your child is not in danger from being with his mother. And she's
Hmm.
like, he thinks I shouldn't even breastfeed because I'm just crying while I'm nursing him. And I'm like, he still needs to be breastfeeding, you know? Gosh, and if anyone needs it, mom needs him to still be breastfeeding because she's really struggling. And um, he meant well. He was trying to protect everyone. But then I'm sure looking back, he was like, oh, shoot, you know, I didn't know what to say.
Right. Right. Because we're not preparing partners for this well, you know, in your prenatal appointments, you know, is your doctor talking to you, to the partner about this? No, especially in the past couple of years when partners couldn't even be in, you know, some of those appointments and we couldn't talk to them specifically about this. I know when I was working in the hospital and I was covering labor and delivery and the postpartum units, we would get a referral if mom's EPDS score, the Edinburgh Postnatal Depression Scale, if her score was over 10, they would call the social worker in to just, you know, follow up and see what's going on. And I mean, yes, would I talk to mom about what she's experiencing and why she answered the questions the way she did? Yes. But the second part of my conversation was to the partner to say, you are now on the lookout because you're the one that's going to be with her and you're the one that's going to see the changes with her. So if you see something, you need to talk to her about it and you need to call the doctor. You need to call me. You need to call someone because now I'm not trying to put the pressure on the partner, but just to be like, this is part of your responsibility, you know, to be aware that that we already know that this is a risk factor because we're a day out of birth and we're already seeing some signs.
So I guess, from there, how do you suggest reaching out if someone is struggling? Like, is it helpful for them to preemptively find someone before there's an issue, or is it better for them to, not prepare for that so that they don't put it in their mind, or what does that look like?
I love preparation, and I say this in all of Sierra's classes also. If you can, before you have the baby, connect with a therapist. That's all I'm asking, right? Like, call a few, have a consultation, see who you fit best with, see whose personality jives with their style, their tone. If it's important to you that you speak to a male or female therapist, like, just get in contact with someone and let them know, like, all I'm doing is just making sure I have someone to reach out to in case this is an issue. A lot of therapists right now are overbooked and full, and it can be very challenging to get in when you need to get in, especially if you're looking for a therapist that has a specialization. So yes, if you can, prepare and just reach out and know that, okay, if we need it, we have them. If that's not possible and it's not on your radar, or you are postpartum already and you're not there, then the same things apply, right? Like, there are resources that have specific directories for therapists that are specialized in perinatal mental health. So you can go down that route. You can call your doula, you can call your lactation consultant, you can call your OB, but just take some time to find a therapist that feels like a good fit, and maybe not necessarily just the first person that can get you in.
Definitely. Yeah, thank you for that. I think that's something that we try at least to focus on in our prenatal period is just helping them prepare not just for the birth and for pregnancy, but for postpartum and everything that, can come with that. So, if you had one piece of advice that you could give to everyone listening in regards to mental health in the perinatal period, what would that be?
I would say, what would my one piece of advice in the perinatal period be? I would say, if it's taking you a lot of energy to do things that normally wouldn't take this much energy, then use that as your bar to decide if you should reach out for help or not. And also, and I guess this is two things, recognizing that you don't have to have a diagnosis to benefit from therapy during any time in life, but especially during the perinatal period, right? Like, this is a humongous transition. It oftentimes brings up past trauma, childhood trauma, relationship traumas, right? And so all of the sudden, some of these feelings are coming up, and you're like, whoa, what is happening? I thought I was just going to have a baby and, live my life and go on. But now I have all of this other stuff coming up. So just listening to your body and not being afraid to reach out for help. And maybe that's my piece of advice is just don't make yourself feel isolated. Know that there is a community out there, and we will connect you. So if your connection is Sierra, then reach out to her and she will point you elsewhere. If your connection is me, I'm a social worker at heart, so I'm going to connect you with every single resource I could ever find, and I'm not afraid to reach out to other therapists or, whatever system you need. I will get you connected, but you need to get to me first, or you need to get to Sierra first. Like,
Or Samantha.
or Samantha first. Like, just reach out to anyone.
Yeah, and that's a perfect segue to our last question for you, which is we would love to know how people can find you. We will also put these in the show notes on your website and how they can follow you on socials. But how would you like people to find you if they needed to?
Sure. I do have a website. It's CherylReillyLCSW.com. And I have a little bit about my specializations on there. Also some information about myself and my story. There's a contact page. So yeah, the website is great. I do have Instagram as well. It's at Cheryl Reilly, LCSW. And I post some occasionally tidbits here and there.
Great content. She's lying. It's great content, and I love it.
Thank you. I appreciate it.
I'm not pregnant or in my postpartum period, and I find value in it.
Yes, I do try to go a little more general in that realm to see what we can get out to people. But yeah, those are the two main ways to get a hold of me.
Awesome. Well, we really appreciate you being on with us. And now you said, people aren't teaching these things prenatally and people don't know, partners don't know. Well, now they can just send this podcast link and go, hey, just like I used to do with everyone else's podcasts.
Right.
So we're really excited that people have the opportunity to listen to you, and we will talk to you soon.
Yay. Thank you so much.
Thank you.
Thank you. Thanks for joining us on Birth, Baby. Be sure to tune in next week as we talk with Amanda about her birth story. Thanks again to Longing for Orpheus for our music. You can look him up on Spotify. Remember to leave a review, share, and follow wherever you get your podcasts. See you next week.